Thank you all so much for being here today, coming out at 3 p.m. on a Wednesday. Much appreciated for those of you who could make it. Very quickly, my name is Meg Lynch. I am with the Providence Democratic Socialists of America, the Medicare for All working group. We have partnered also with Physicians for a National Health Program, Rhode Island. And we have been working on this legislation that you'll be hearing about very shortly. And we're just so appreciative of you all for being here, and hopefully we can get your questions answered and things like that. And we are just really urgently ready to pass a Medicare for All legislation in Rhode Island, statewide. So we'll be hearing from a number of speakers today. We have some legislators here with us. We have some faith leaders as well, and some physicians that we'll be hearing from. So we'll get started right away. Our first speaker, we have Representative David Morales here to talk to you all.
Good afternoon, everyone. Thank you all again so much for being here. Now, friends and supporters, as we kick off this important press conference, we need to be absolutely clear. We have a broken healthcare system, both within our state and in the country as a whole. We have a cruel healthcare system that is driven by profit and greed that has left thousands of people, particularly working people in our state, lacking the medical services and necessities that they need. Similar to other socioeconomic issues, it is often our communities of color and members of the working class that are disproportionately hurt. They are hurt by the fact that over 40,000 Rhode Islanders are uninsured, and 45% of those who do have health insurance are underinsured, which essentially means that they're individuals who do not seek healthcare services because of the fact that the co-payments and out-of-pocket expenses in their insurance plans are too high for them to even seek the treatment that they need in the first place. So in other words, we have hundreds of thousands of people across Rhode Island who cannot and do not receive the important medical treatment that they need because it is too expensive, which would otherwise force them to go into deep medical debt. Therefore, it is clear, a healthcare system that is dependent on employment combined with complicated health insurance plans is not a sustainable model. So for that reason, Senator Sam Bell and myself have continued to introduce legislation to radically transform our healthcare system and establish a single-payer Medicare for All healthcare system that will provide coverage to all Rhode Islanders, free of out-of-pocket expenses or co-payments, regardless of socioeconomic status. Now, I do want to be absolutely clear. This is not a quote-unquote pie-in-the-sky idea or something that is out of reach or an unrealistic proposal, because the model that we have developed is both economically feasible and, most importantly, sustainable. In specific, our legislation would require our state to further invest state dollars into Medicaid by significantly increasing Medicaid rates, eligibility, and coverage through the state budget. In addition, we would also focus on de-privatizing our state's Medicaid program and the outsourcing within our Medicaid office. Now, this is important to note given the fact that the federal government matches state investments into Medicaid, funds that we would then be able to use within the next 2 to 3 years to request a waiver from the federal government so that the federal funds and healthcare subsidies that we receive now be directed to our Medicare for All single-payer healthcare system. Now, given the fact that we have a Democratic president, now would be the time to urgently pass this bill and begin negotiating with the Biden administration to ensure that we have the resources necessary here in our backyard in Rhode Island to establish this single-payer healthcare system. So following this, we would now create a state agency to administer the Rhode Island Comprehensive Health Insurance Program, otherwise known as RIDECHIP, where networks, co-pays, deductibles would all be eliminated. This means that Rhode Islanders would be able to go to the doctor of their choice, the pharmacy, and hospital without having to pay additional fees. Such coverage under RIDECHIP would include medical care, cost-free prescription drugs, dental and vision care, and mental health services. So all that said, everyone would benefit from a Medicare for All healthcare system, Working people making less than $200,000 a year would be saving about $4,000 plus annually as it relates to the healthcare services and treatment that they receive. Now, I do want to be clear. For-profit providers would still be able to offer their services here in Rhode Island, but they would be prohibited from charging patients more than the ride-ship reimbursement rates. So in other words, the for-profit providers would no longer be able to price gouge our residents and take advantage of them if someone did choose to still enroll in the private market. So overall, a statewide single-payer Medicare for all healthcare model would get rid of the middle person, the for-profit health insurance companies, while leaving our current healthcare providers in place and finally providing them with more freedom to deliver care with less administrative bureaucracy that has caused so much harm to our working people. So on that note, we are calling on the political leaders here at the State House to pass this legislation and ensure that we are on a path where in Rhode Island, healthcare is seen as a human right, not a commodity, not a business opportunity, not a privilege, but a right. Thank you.